Today, the CDC said it's doing a detailed investigation to try and determine how Pham became infected while wearing protective gear.
If this one individual was infected and we don't know how within the isolation unit, then it is possible that other individuals could have been infected as well.
The nurse in Dallas, Nina Pham, says she's doing very well. But with every day comes another piece of alarming news about Ebola in America. We now hear there were 70 people caring for the Dallas patient who eventually died. Passengers on flights are using the word Ebola as a scare tactic. And even a network television reporter who was supposed to know better violated a quarantine, something that could assist in the spread of the virus. How do we bring this situation back under control, and whom do we trust to do it? Welcome to MidPoint, the chairman and founder of Leavitt Partners and former secretary of the U.S. Department of Health and Human Services, also former governor of Utah, Michael Leavitt. Mr. Leavitt, thank you so much for joining us today.
Thank you for inviting me.
When you hear words from the World Health Organization that they are now looking at 10,000 new cases per week, does that not tell you that at least in Africa, this disease is completely out of control and could threaten anyone, anywhere, at any time?
Well, that's exactly what it means. Pandemics are a function of history. They happen. We have one every 30 or 40 years. They happen infrequently enough that one generation tends to forget about it and inadequately prepares. We've had 10 of these in the last 300 years that we can document. So this is just a biologic fact of life, and we have to be prepared. And preparation isn't just about calling on the government to stop this. This is biology we're talking about here. This is the natural world, and not simply something that government can pass a law and stop.
In your opinion, then, did we get caught flat-footed? And I say that because so many people are asking that question. How did we get caught so flat-footed in dealing with Ebola? But from what you're saying right now, were we simply just ignorant, arrogant? What was the reason why, with all this history behind us, we weren't ready?
If we went back in the United States over the last 8 years, you would find that we were extraordinarily poorly prepared. We had no vaccine capacity. The public health infrastructure had gone to seed. We had a scare with the avian influenza. They called it the H5N1 influenza. And at that point, the Congress did appropriate $8 billion. And we began a campaign to bring the United States back to a point of better preparation. We're better prepared, but we're still vulnerable. And we're vulnerable because we are part of a global world, and we're only as safe as the weakest link in that chain. Liberia ends up getting out of control because they have poor infrastructure, and suddenly the United States is at risk. So this is the nature of pandemics, and it's the reason that we all have to be part of the response. And when I say all of us, I mean all of us. We all have to practice good public health practices. We have to be prepared in our homes and in our businesses and our churches to deal with this if and when it occurs.
So does the American public then, and you use the phrase gone to seed, so does the American public then take partial responsibility for where we are today? Not that they're responsible for Ebola or anything like that, but certainly just the fact that we're so stunned that something like this happened?
We all have a responsibility to be part of the preparation. Now, there are some unique things that government can and must do. For example, government has to define what this disease is, how dangerous it is, how it spreads. Government is the best one to have disease detectives who are working to contain this as it occurs. Government has to be involved in the creation of a vaccine, etc. The general public can't do that. But to expect that the federal government, the state government, or the local government is going to be able to take care of everyone in a situation like this just goes beyond description, because by its nature, a pandemic is everywhere at the same time, and no government has that capacity. Not because they don't have the will or the wallet, it's just that it's impossible to be everywhere at the same time.
In about 30, 40 seconds, and then we'll take a break, come back. But let me ask you this, in your opinion then, if we boil this down to the ground level, somebody had to be responsible for not sounding some warning bells here and getting us ready for this. Is it one person, one group of people? Who is it?
Well, I think that we have to acknowledge that the warning signs were there, and there was information out there about this. And I know you're having to go to break, so we can talk more about it when we come back.
All right, I will say that's absolutely fair. We'll let you think about that for a moment, because when we return, not only the answer to that question, but the call for an Ebola czar is made. But should that not be what we don't have, a Surgeon General? And later on this hour, the nightmare of dealing with the